All right, back to the screen share and then we'll get started. Okay. All right, welcome everyone again. It's nice to see everyone. We're going to talk a little bit today about the Emergency Solutions Grant funding that has been made available as part of the CARES Act. And just to introduce myself, my name's Julie Lemmer and I'm with Home Base, which is a nonprofit organization that provides technical assistance. And I know some of you, we do some work in Marin. Notably, we helped with the ESG, the regular sort of annual funding stream. You may have met my colleague, Tara, and I helped with that. Today, I'm joined by Jean, who's going to be helping monitoring the chat box. And speaking of the chat box, I think we all are, by now are pretty used to using Zoom, unless anyone has a particular question. But if you have any questions, please feel free to put them into the chat box. You're also welcome to, I'm going to ask everyone to go ahead and put yourselves on mute for now. But if you do have any questions or you want to make any comments, please feel free to mute yourself at that time. As we've said, we're recording this, so this should be made available later, and the slides will be as well. So with that, I'll go ahead and get started. Today's agenda is going to be pretty much, I'm going to go over the ESG program just in general, because I think this is probably something that's new for some of you. And then we'll talk about just a little bit about the regular funding and then the new source of funding, which is the Esgcv, and how it's a little bit different. We'll go over the grantee obligations, the activities that are eligible, and then the participants that are eligible and how you document all those things. So we'll just go ahead and jump in. So in general, the ESG program is an annual program available to provide funding for homelessness programs, including street outreach, to increase and improve emergency shelter options for homeless families and individuals, and then to operate those shelters and provide essential services to the shelter residents. Also, rapid rehousing to rapidly rehouse homeless individuals and families. So, sorry, somebody's not on mute. If you guys could, everyone could just go ahead and put yourselves on mute, and then just wait until you have a question or a comment to unmute yourselves. That would be helpful. Thanks. Okay, so homelessness prevention is also an eligible activity under the regular ESG program, but we'll be talking a little bit more about that later as well. And then the way the funding is administered, it's administered through HUD and distributed either directly to localities as entitlement jurisdictions or to the state, which then distributes it to localities. And so the balance is I think of it as entitlement jurisdictions or balance of state jurisdictions. And in Marin is a balance of state jurisdiction. And so in California, the balance of state allocation goes to the Department of Housing and Community Development, or HCD, who then distributes it to the COCs. And in Marin, it's generally administered through the County Department of Health and Human Services. So just for those of you who don't know, Marin's regular, the annual balance of state allocation for 2020 was about $170,000. And it was used to fund rapid rehousing and 2 emergency shelter programs. And that number 170 is interesting because you'll see just how unprecedented the CV allocations are. But just to talk about minimum eligibility, so participants in the ESG program are required to meet one of the definitions of homelessness, which we'll talk about later. And then each of these different categories has to be documented. And again, we'll talk about that a little more later. So what we're here to really talk about today is the coronavirus funding. So additional funding was made available in 2 rounds through the CARES Act. And that funding has to be used to prevent, prepare for, and respond to coronavirus. And the funding's been given the designation ESG CV just to set it apart from the regular funding, ESG funding. And as I said, the CARES Act designated kind of an unprecedented amount for ESG funding. It'll be distributed by HUD in the same way. So for Marin, it's coming through HCD. And the first entitlement amount was $42 million, and Marin's allocation was nearly $600,000. So the COC's governing board, the Homeless Planning Steering Committee, has determined community priorities for these funds. And for the first round, the money is going to be used in Marin for street outreach. The second entitlement amount was $253 million for the state of California, and Marin's allocation here was over $5 million. So the HPSC has determined that community priorities for this round will be emergency shelter, street outreach, and rapid rehousing. So for the ESG CV funding, the goal, again, of course, is that the funding is going to be used quickly and effectively to respond to the current coronavirus crisis. So in order to sort of further that goal, HUD authorized several waivers of ESG regulations in a notice that was released in September. So just to point out, and we'll talk a little bit more about these later as they come into play, but just, I know some of you are familiar with the regular ESG, so I just want to point out off the bat that there are some major differences. So there's no match requirements for CV funds. There's no caps on emergency shelter and street outreach. There is the FMR limits are waived, but units must still meet rent reasonableness standards. And in addition, the rental assistance available under the CV2 fund, so the second round of CV funding, is limited to 12 months, and we're going to talk about that a little bit more later too. And then the monthly case management requirement is a little bit different too. So it's waived. It was under the regular ESG, there was a requirement that case managers meet once a month with participants receiving rapid rehousing assistance, and that's been waived for the CV2 funding. And then the ESG CV also provides for additional activities that are not provided for under regular ESG, and these are volunteer and landlord incentives, hand washing stations and portable bathrooms, training on infectious disease prevention and mitigation for staff, as well as hazard pay, and then temporary emergency shelter, including the leasing and acquisition of property, renovation, operations, and services. And again, we'll be talking a little bit more about this in a little bit. And then just to point out another source of waivers, HUD has issued a series of waivers associated with the community planning and development, the CPD programs, which includes ESG. The main impact of these waivers for our purposes is that it expands eligibility, participant eligibility by expanding the one of the definitions for homelessness, which we're going to talk about in a little bit. But for now, I'll just say that the Category 1 definition permits stays in institutions of up to 90 days without, up to 120 days without forfeiting homelessness status. So it just kind of expands that definition to include more people. And then if you, as we go through this and you feel like you want more information about this, Homebase has developed a memo that outlines these waivers and how you would go about obtaining one. Okay, so just to touch on ESG, the second round of CV funding, HCD has outlined what its priorities are for this particular source of funding. So it's urging people, participants using the funding to prioritize the advancement of racial equity. And it's going to require grantees to submit related racial and ethnic data metrics from HMIS. And we'll talk about HMIS a little bit more later as well. And it's also requiring grantees to prioritize rapid rehousing and emergency shelter activities over homelessness prevention. And in fact, for the CV2, homelessness prevention is only allowed if all the homeless individuals in the community have been housed already. So effectively in Marin, we're just going to say that homelessness prevention is not really an allowable activity. Here are the expenditure deadlines for the funding. If the deadlines aren't met, HCD has said that it may recapture the difference in funds between what's been actually spent and the expected expenditure at the deadline. And the deadlines are the same for both rounds of the ESG CV funding. So it's a fairly tight deadline here. Okay, so I'm just going to pause there for a moment. That's kind of the overview, and then we'll get into the specific requirements. But does anybody have any questions before I go on? Okay, doesn't seem like. Okay, we'll keep moving then. All right, so let's talk about grantee requirements. Just to start off, in case you get really interested and want to go study up, these are the main sources of authority that govern the use of both ESG and ESG CV funding. So the CV funding, as I said, comes from the CARES Act. So you can take a look at the CARES Act, and then there are, HUD has some notices or the ESG CV notice and program waivers. The HCD has put out 2 NOFAs, one for ESG CV1 and one for CV2 that contains some of the requirements. And then there's of course, the federal regulations and the California Code of Regulations. And then of course, you'll also be looking at the Marin's RFPs and then any subrecipient grant agreement. So just to kind of run through some of the general requirements for those using ESG funding. So you have to have ESG compliant policies and procedures on file. You'll be required to participate in the Marin Coordinated Entry Assessment System, which means that the project is going to be required to enter and receive referrals through Marin's Coordinated Entry System. Participants have to collaborate with the COC, which will monitor project compliance. Your program will have to be in alignment with Housing First. So none of the ESG CV funds provided under the CARES Act can be used to require people experiencing homelessness to receive treatment or to perform any other prerequisite activities as a condition for receiving shelter. So just basic Housing First principles. There are applicable procurement standards for procuring goods and services that may come into play. You have to maintain financial records in accordance with the standards and the regulations, and be prepared to provide information needed for reporting requirements. We're going to talk a little bit more about documentation requirements, but basically you need to maintain files that will demonstrate that your clients meet one of the established categories of homelessness. And then there will be some additional documents required by HUD that we'll talk about. And then just generally it's recommended to internally review your files to ensure compliance. And then data reporting. So participants are required to work with the county to provide HMIS data, and let's see, we'll talk about that here. Yeah, so all ESG funded subrecipients are required to enter participants in the community-wide HMIS, which is the Homeless Management Information System. So with one exception, any subrecipients that are forbidden by statute to participate obviously don't have to. So that would be like the domestic violence DV providers are the usual ones that are exempt. And then all HMIS participating agencies have to collect and maintain data, client level data, which includes the client identification information and demographic information, as well as data on project specific aspects, including housing and services provided to the clients. And then, so recipients are required to report on the uses of ESG CV funds. And I think, Carrie, you can kind of correct me if I'm wrong, but I believe that the county will be pulling the reports from HMIS and submitting the reports that way, but it's really important to have accurate information entered into HMIS. Carrie, I see you unmuted yourself.
Yeah, I think we're actually still waiting to hear from the state if they have any guidance about how exactly the CAPER is going to work.
Okay.
That's my guess, since we're going to be the contracted partner. But we'll be, since, you know, ultimately it's going to be on us to make sure that we're submitting accurate data. We're going to lean pretty hard on contracting partners to make sure that the data is getting in there in a timely and accurate fashion.
Okay, so does anyone have any questions about HMIS or the reporting requirements?
We have one question about housing unit standards, and they're asking does ESG rapid rehousing require the same housing unit standards as Section 8? E.g., we can't use Section 8 for marina slips, but could ESG funding support that type of housing intervention? I don't know the answer to that question specifically, but for rapid rehousing, there is a housing habitability standard checklist that is different from, I believe it's unique to ESG. I'm not sure. I know there's a housing quality standards and a habitability standards that are fairly similar between the two, but with a couple of exceptions. So that's a partial answer to your question, but we can research it further more specifically.
I've tried to do that with ESG funds in the past, and it has not been approved. I don't know if that's changing with this next year.
They don't appear to have any waivers to habitability standards, except that some inspections can be virtual, I think has been one of the waivers.
Okay. Thanks, Jean. Okay, and then there's one more sort of reporting requirement that I want to talk about, and this is the duplication of benefits. So this is basically, with all these sources of funding coming down in response to COVID, HUD and then HCD has kind of made this sort of a priority to require that recipients establish and maintain adequate procedures to prevent a duplication of benefits. So duplication of benefits is kind of what it sounds like. It's when a program receives assistance from multiple sources of funding. So it duplicates funding for a particular cost. So and this is going to apply, as far as we know, to subrecipients as well. So a subrecipient that receives ESG CV funding will have to demonstrate that it has not previously received or will receive duplicative assistance from another source. And this may entail asking questions during client intake about whether they're receiving other potential sources of assistance. But again, we're all waiting on more guidance from HUD and HCD regarding the duplication of benefits. Just to kind of give you a heads up, this is another sort of documentation reporting requirement on the horizon. Okay, so any questions about grantee requirements or obligations before we move on to eligible activities?
I just want to add that we're going to be, part partnering with Homebase to make sure that there are all the resources in place to like figure out, how do we do that, prevent duplication, how do we get, policies and procedures set up. So this isn't just like you'll get the money and then you have to figure all this stuff out in a vacuum. We'll have resources to help with that.
Absolutely. Thanks, Carrie. Okay. All right. Unless we have more questions. Okay. We'll move on to the next thing. Okay. So again, HCD has identified priorities for ESG CV, and of course, the main one is to prevent, prepare for, and respond to coronavirus among those experiencing homelessness, and also to provide low barrier, housing first oriented housing. There's a couple of additional priorities for ESG CV too, and that is to focus on rapid rehousing, to rehouse as quickly as possible those experiencing homelessness, and then secondly, to address racial disproportionality in homeless populations. So just again, so ESG CV can be used for street outreach, rapid rehousing, emergency shelter, and although technically it can be used for homelessness prevention, as I said, especially for the CV2, which is our biggest source of funding, homelessness prevention is essentially not going to be eligible. It's only eligible if a community can show that all of their homeless people have been housed. So don't think we're quite there yet in Marin. So. Okay, so let's look at street outreach, eligible costs for street outreach. And these include engagement, which is what it sounds like, the cost to locate, identify, and build relationships with unsheltered folks and connect them with assistance. So these would be things like making an initial assessment of needs, providing crisis counseling, addressing urgent physical needs such as meals, blankets, clothes, toiletries, connecting and providing information and referrals to programs. And then the next one, case management. Again, I think most of you know case management is the costs of assessing housing and service needs, arranging and coordinating the delivery of individualized services, documenting eligibility, counseling, coordinating services, developing housing plans, etc. Street outreach can also be used for emergency health and mental health services. So this would be costs for outpatient treatment of medical conditions, should be provided by a licensed medical professional, operating in settings including streets, parks, encampments, basically anywhere unsheltered homeless folks are living. It can also be did someone just join that could maybe mute themselves, please?
I also have the cat power to mute, and I am.
Oh, okay.
I am using it.
Thank you, Jean. Okay, I'll leave it to you then. Okay. So street outreach can also fund the cost of transportation, and this includes travel by outreach workers, social workers, medical professionals, during the provision of services. It can also include transporting unsheltered people to emergency shelters or other service facilities, travel on reimbursement or vouchers for public transit. You can even use it to purchase or lease a vehicle for staff use, and include the cost of gas, insurance, taxes, and maintenance. And then finally, the services for special populations. This just means you can use it for costs otherwise eligible under the street outreach component that are tailored to address the needs of special populations, including youth, victims of domestic violence, people with AIDS, HIV, etc. So the CV funds can be used for additional activities, and these include hand washing stations and portable bathrooms, volunteer incentives, So getting volunteers to participate, you can give them incentives like cash or gift cards, things like that. And then training on infectious disease prevention and mitigation for staff who are working. And again, all these things really do still need to be tailored directly to the coronavirus response. Yeah, and used for people who are experiencing homelessness or at risk of homelessness. Okay, any questions on street outreach before I move to rapid rehousing? Okay, so rapid rehousing is another component of the ESG program, and funds here can be used for rental assistance, so short-term and medium-term, and then it can also be used to cover rental arrears. Financial assistance, including application fees, security deposits, utility deposits and payments, last month's rent, moving costs, things like that. Services, including housing placement, housing stability, case management, landlord-tenant mediation, legal services, credit repair. So there is a rental assistant limitation applicable to the CV2, which I kind of touched on earlier, but medium-term assistance is usually defined as 3 to 24 months of rent. So for the CV2 funding, this requirement is changed and it's limited to no more than 12 months. And the idea here is they're trying to get more households to receive rapid rehousing and homelessness prevention. Well, we're not going to talk about homelessness prevention. So more households to receive rapid rehousing to respond to the coronavirus crisis. And then again, there's the waiver of the FMR, the fair market rent, which is usually a restriction on how much rental assistance you can provide, but it's waived here under the CV fundings, but just so long, you still have to comply with HUD's standards of rent reasonableness. So, and then there's also additional activities, just like under street outreach, there are some additional activities under rapid rehousing, and they're kind of the same, but includes landlord incentives. So you can still use it for hazard pay for staff that are working directly with those who are at risk of, or staff working directly to prevent, prepare for, and respond to coronavirus among those who are homeless or at risk of homelessness. The landlord incentives can be used to pay landlord incentives is reasonable and necessary to obtain housing for individuals and families. There is a limitation on landlord incentives, however, and it's so the landlord incentive is limited in the amount to an amount that exceeds. It's limited to 3 times the rent charge for the unit. So the maximum amount of landlord incentives you can use is 3 times the amount of the rent. The volunteer incentives, same as with street outreach, and then same with training. You can use it to train on infectious disease prevention and mitigation for staff working in these circumstances. Okay, so any questions on eligible activities under rapid rehousing?
Can you say a little bit more about landlord incentives? Is that like, are you can pay a landlord up to 3 times the rent for what exactly?
Okay, so landlord incentives are typically things like, sometimes they'll ask for an additional amount of security deposit to cover damages or to cover if a tenant doesn't end up paying their rent. You know, it can be used as a fund that landlords can reach into to sort of mitigate any risk they might feel that they're taking on by housing a formerly homeless person.
Could I just add in, Julie, that it's fairly generous as written into the ESG CV notice, that it can just also be a signing bonus. If you want to use that as an incentive to recruit a new landlord into your program that maybe has reservations about working with your program, it can be a signing bonus of up to 2 months rent, whereas the security deposits can be up to three months rent. So it's a pretty exciting opportunity. A number of communities have used these through foundation money and other non-federal funds and have found quite a bit of success with them.
Yeah, that's very generous.
Great. Anyone else? Okay. So emergency shelter is another component of the ESG program, and it's also eligible for the CV funds. And so emergency shelter eligible costs include shelter renovation, the provision of essential services for shelter residents. And this includes, again, case management, childcare, education services, employment assistance and job training, health services, legal services, life skills training, things like that. And then it can also be used for shelter operations. And these are the costs of maintenance, rent, security, fuel, equipment, insurance, utilities, furnishings, supplies, things that are necessary for the operation of an emergency shelter. There's also, under the ESG CV specifically, you can use the money to maintain sanitary shelter environment. So for example, it could cover things like cleaning supplies, I think bleach, disinfecting wipes, those types of things, personal protective equipment like masks, gloves, any special furnishings that you might need to, so like dividers to divide, keep people separate, 6 feet apart. Equipment like washers and dryers, hand washing stations, those types of things. And then again, we have under emergency shelter component, these same additional activities are eligible. So the hazard pay, the volunteer incentives, and the infectious disease training. And then temporary emergency shelter is another additional activity allowed under this component. So a temporary emergency shelter, they define it as a structure or portion of a structure used for a limited time because of the crisis to provide shelter for displaced individuals. And there's, HCD and HUD have provided guidance on the costs associated with temporary emergency shelter that can be covered. So these include acquisition and renovation, and then the same sort of shelter operations and services. And then any other shelter costs that HUD pre-approves in writing. So just a note on this, HCD is discouraging the use of temporary emergency shelter funds for acquisition and renovation because it looks like these funds are going to be subject to federal law requiring. So once the temporary emergency shelter is closed, HUD may require repayment of the funds that were used to acquire or renovate the shelter. So instead, HCD is encouraging people that want to use it for temporary emergency shelter to use it for operations and services instead. And it can be used for those purposes until January 31st, 2022. Are there any questions on emergency shelter or temporary emergency shelter?
I just want to make a quick note that the emergency shelter funds that we're getting through round 2 are not going to be RFP'd out.
Okay.
So folks shouldn't worry too much about the emergency shelter portion.
Okay. Thanks, Carrie. Okay. So then just moving on, this is, we've kind of gone over this, but I just wanted to point out that HUD has released this guidance that particularly talks about additional ways that the funds can be, I mean, so since they're the CV funds are targeted toward infectious disease response. HUD is providing some guidance on additional ways that the funds can be used for that purposes, things that you might not normally think about, but that we have talked a little bit about already. So it lists, and I'll show you on the next slide. It lists the supplies and equipment and training that you can use it for street outreach and temporary shelter. So again, just things like cleaning supplies like bleach and disinfectant, personal protective equipment like face masks and gloves, washers and dryers, portable bathrooms and showers, and expanded staff and training, including the hazard pay. I think these things we've mostly already covered. Okay, so are there any questions just overall about eligible activities under the ESG CV funding? And if not, we'll move on to eligibility and who's eligible to be served and how do we document that eligibility. So again, just to sort of restate, the participants who can be served by ESG have to meet one of the defined categories of homelessness. And I have them listed here. It's Category 1, Category 2, and Category 4, and we'll talk a little bit more about those. The fourth one is at risk of homelessness, and that really only applies to homelessness prevention. So since we're not going to be using these funds for homelessness prevention, we get to skip that portion. And then finally, just a note that when we get into talking about documentation, just generally third-party verification of homelessness is preferred. So third-party documentation is preferred where possible. Okay, so again, here's a little slide that shows eligibility by program type, and we're going to go through each one of these. But for street outreach, it's Category 1, emergency shelter, Category 4, 1 and 4, and staying in emergency shelter. And then we don't need to talk about homelessness prevention. And then rapid rehousing, it'll be folks who are Category 1 and Category 4 and live in an emergency shelter. Okay, so we'll start with Category 1 and go through the definition. So HUD defines, so Category 1 is literally homeless. And HUD defines literal homelessness as a household that lacks a fixed, regular, and adequate nighttime residence. So this can include, this can include sleeping in a public or private place not meant for human habitation. So these are places like in the street, in a tent, in a park, in a car or abandoned building. Even an RV would be included here so long as it's not connected to utilities. And then the second component is, okay, if either primary nighttime residence is not meant for human habitation or someone who's residing in a shelter, and then, or somebody who has, who was literally homeless, so had been living in a place not meant for human habitation, but then was in an institution for 120 days or fewer. And then, so upon exit from that institution, they would still be considered literally homeless. Now, just a note on this. So typically this definition is exiting an institution after 90 days. But under one of those program waivers that we talked about, they've expanded this definition. So it's anyone who's exiting an institution after 120 days. So if you're exiting an institution after 120 days, and before that you were living in a shelter or someplace not meant for human habitation, then when you come out of that institution, you will be considered literally homeless. Some things that literal homelessness does not include are couch surfing, two families doubled up in one unit, sober living homes, or a motel or hotel that the client paid for themselves. So just to keep those things in mind. So to document Category 1, So these are the various ways to document it. So the night before program enrollment, you would want to document by way of one of the following. So third-party verification of the conditions where the individual or family was living. So that would be like a written observation by an outreach worker, or if there's an HMIS record. If you can't do that, then certification based on the intake conversation, or certification by the individual or head of the household that's presenting to seek assistance. So if you have an individual that was in an institution, you'll also need one of the following: the discharge paperwork from the institution, or a written or oral referral. You need to document the written or oral referral from the social worker, case manager, or other official from the institution that includes the start and end dates of the residency, because remember, we need to show that it's been 120 days or fewer. And then if you can't get either of those things, just a written record of the intake worker's attempts to attain the evidence, plus a certification by the individual that states that they were in the institution for less than 120 days. Okay, so just to, we can kind of work through an example here. So let's say we have Lily, and she's presenting at your program after her release from a mental hospital. She entered the mental hospital 6 months ago when she began experiencing delusions. So before she went into the mental hospital, she had been camping in a wooded area, and she had nowhere else to stay. So does Lily fall into category 1? Does she qualify as literally homeless? Does anyone want to venture a response?
No, because she was there for more than 120 days.
That's right. So she would not actually qualify as literally homeless because her stay in the institution was more than 120 days. Okay, but so let's say she was only in the hospital for 75 days. So let's go through what documentation would be required. So does anyone else want to try to explain? So basically we would need a written observation by an outreach worker to show, to say what the living conditions were, where, so she was in a wooded area. So if we could find an observation by an outreach worker sort of certifying those living conditions, a written referral by another housing or service provider would also suffice. And if all else fails, Lily can self-certify that she was living in those conditions. And then because she's exiting the institution, we would also want to get the discharge paperwork from that mental hospital, or a written or oral referral from the institution that included the start and end dates of the residency. And then finally, if none of those are obtainable, we can document this with the intake worker's due diligence or attempts to obtain the evidence, plus Lily's certification that she was in the hospital for less than 120 days.
Julie, Colin put a question into chat about whether if the person has a physician is a licensed medical provider able to provide certification of homelessness. And the answer is yes, but it's not necessary to be a licensed professional to provide that certification. Typically, communities will just use a form where it can be anyone, really, that it's a third party. So say someone's been sleeping in front of a business and there's documentation, you could have the business owner sign that. If it's a street outreach worker who has observed the person in a particular place, it can be that person. Typically, if the person is entered in HMIS at a shelter, that can be third-party verification. I just also wanted to add, although we don't go too in-depth for it, third-party verification is always what HUD prefers, and there are limits on the amount of self-certification that you can have in your program. We won't go into it too in-depth, but if it is somebody who's self-certifying, you want to document why you couldn't get other documentation. So always just think of it as an auditor coming to look at your files and what you're going to need in there to prove that people are eligible for services.
Jean, would the if there was a medical provider certifying the homelessness, what would is there a specific source of their knowledge? Like, would it just be, I've been serving this client and they told me that they're homeless? Is that sufficient, or do they have to say, like, you know, do they have to have some additional source of information for that than just, you know, the client has told them that they're homeless?
That's a great question. I don't know the answer specifically, but I think it probably would pass muster so long as there were other indicia in the file that the person was actually homeless. So for example, especially if it was an outpatient clinic or it was a clinic at a day center, that would be particularly compelling, I would think.
Great questions. Thanks, Jean. All right, then we'll move on to the second category, category 2, at imminent risk of homelessness. So imminent risk of homelessness includes individuals or families who will imminently lose their primary nighttime residence. So imminently means within 14 days. They have nowhere else to go, so no subsequent residence has been identified, and they have no resources or support networks to obtain other permanent housing. So for category 2, we've got those 3 subparts, and each one of them has to be documented. So we'll go through each one here. So for the residents will be lost within 14 days. The documentation requirement would be one of the following of either evidence of eviction within 14 days, or for households whose primary nighttime residence has been a hotel or motel, you can use evidence that they don't have funds they can't afford additional nights within the next 14 days. Or you can use an oral statement by the household member, and that should be recorded and verified. So if you can, you verify with the landlord, or if you're not able to contact the landlord, document your attempts to do so. So you document your attempts to get the verification and to obtain written certification by the household. Does that make sense?
Mm-hmm. Okay. And Julie, if I could add, we didn't go into this because understanding that homelessness prevention is not going to be one of the primary sources of this funding. But for those, if there's anybody using other sources of prevention dollars, just be aware that the eviction moratoriums that are in effect will impact whether somebody has evidence of an eviction with 14 days.
Okay. So part 2, they have no subsequent residence. So this can be documented by certification by the individual or head of household that no subsequent residence has been identified. And then part C, that they lack resources or support to obtain housing. Again, this can just be certification or other written documentation that the household lacks resources and support networks. Okay, so here we can run through another example to sort of illustrate how category 2 works. So we have Steve, who recently lost his job and couldn't afford his rent. So he crashed with various pals until the last one kicked him out. When his former high school teacher, Pete, saw him sleeping outside, he said that he could stay with him. But then when Pete found out that Steve was drinking heavily, he told him that he needed to get out by the end of the week. Steve has friends and family he can stay with, but he has no money to pay for a hotel or his own place. So is Steve qualify as category 2 homeless? Anyone want to chime in?
They get harder when they look closer to real life, right?
I don't think so.
Yeah, that's right. So in this particular example, it says that Steve has friends and family that he can stay with. So he does have subsequent residents and support networks. So he would not actually qualify as category 2 homeless. But let's say he doesn't have a subsequent residence identified and he lacks the resources to obtain permanent housing. What documentation would we need to show that Steve does meet category 2 standards? So basically, remember there are 3 parts that need to be documented. First, we would have to document that his residence will be lost within 14 days of his application for services. So we said that we can do that by an eviction notice. And then we also need to document that he has no subsequent residence identified and that he lacks the resources or support networks to obtain other permanent housing. Okay, so are there any questions on category 2 imminent risk of homelessness or documentation requirements for it? Okay. Okay, so we will move on to category 4, which is fleeing or attempting to flee domestic violence. So this covers individuals or families who are fleeing domestic violence and have nowhere else to go and no support network. So again, it's kind of a 3-step. They're fleeing or attempting to flee, have no other residence, and have no resources or support networks to obtain other housing. And I'll just, domestic violence, I think most people kind of know what that is, but just in case, includes dating violence, sexual assault, stalking, other dangerous or life-threatening conditions that relate to violence against an individual or family member that make them afraid to return to their primary nighttime residence. So for domestic violence, self-certification that the client is fleeing domestic violence, has no subsequent residence, and lacks resources to support, lacks resources or support needed to obtain housing. A client certification will suffice. If not a victim service provider and the safety would not be jeopardized. So in other words, if you are not a victim service provider and the safety of the participant would not be jeopardized, you can obtain an oral statement which can be documented by written observation by the intake worker or written referral from an organization from whom the individual has sought assistance. Okay. Any questions on fleeing domestic violence, category 4? Okay.
And we would just urge that working with your survivor network within the community to make sure that whenever you're collecting documentation, that you're doing so in a manner that is safe and provides safeguards for that person in the future.
Okay, and then I just have a few notes on emergency shelter documentation, and just to run through this a bit quickly. So obviously, HUD recognizes that third-party documentation at the emergency shelter level is not always feasible. So in that case, self-certification would be satisfactory. And then one way to meet this standard would be to require a sign-in sheet at intake. And the household would complete a statement informing, or when they sign, they certify that they are homeless. So signing a sign-in sheet with a statement at the top that says, that lets the individual know that by signing this sign-in sheet, you are certifying that you are homeless, would be a sufficient way to document that. And then for shelters that that are just nighttime shelters and the participants leave during the day, you're going to have to get this documentation every night. But if the program participants stay more than one night, then you can document based on the first night. So, yeah, and then just an important note is that lack of third-party documentation should not be used to prevent an individual from being admitted to emergency shelter or from receiving street outreach services. So just because you can't get it doesn't mean you shouldn't deny the services on that basis. And then one more note on income assessment for rapid rehousing. So an income assessment is not required at the initial evaluation, but it will be required at reevaluation. And so just as a reminder, the eligibility for rapid rehousing requires that the household have an annual income of no greater than 30% of AMI. Any questions on just overall on documentation or eligibility? Anything else that we've kind of gone over? Okay. So I've got a few more just review questions to sort of help digest some of this information. So the first question is, we have Larissa, and she's presenting at your program. She's currently living at an emergency shelter and has been living there for 5 months. What is Larissa's homeless status? Anybody? Colin's got the answer.
I just feel bad no one answering, so I'm happy to answer. She's category 1.
That's right. So she's category 1. She's literally homeless. So for literal homelessness, just to sort of run through again the documentation requirements, you're going to need third-party verifications of the conditions where she's living. So here she's living in an emergency shelter. That should be sufficient, or if you can't get that, then certification based on the intake conversation or self-certification by Larissa. Okay. So now we have Lauren, who was married 2 years ago. Her husband has always been controlling, but lately he's become abusive. So one night he threatens to kill her and she flees, taking nothing with her, and goes to an emergency shelter. When she presents at an emergency shelter, what is her likely homeless status? This is an easy one.
Can't make Colin answer everything. I'll go with B.
Category 4.
That's right. Thank you. So she would be category 4, attempting to flee domestic violence. So she's there because she's afraid to go home because of her husband's threats. And she's fleeing domestic violence. She took nothing with her, so she lacks other resources. And we're assuming that since she presented at a homeless shelter that she has no other support networks or other place to stay. But again, it's very important to document each of these components. Okay, last question. Do you need third-party verification for a client seeking to stay at an emergency shelter? And the answer is...
You don't need it, but it's smart to get it.
Yeah, right. Okay, perfect. Yeah, so you don't need third-party documentation because it's often not feasible. So, and as we talked about, you could get certification by way of a sign-in sheet with a statement at the top. So when people present, they sign a sheet. By signing the sheet, they acknowledge and certify that they are homeless. And that's brings us to the end of what we have prepared. Are there any questions about ESG generally, ESG CV, eligibility, documentation, any of the things that we've covered, or anything else?
I have a question, just in terms of the ideas, what your thinking is for when RFPs might go out or when they might be due or anything like that, or is it too early to be asking that?
So it's not too early to be asking. We don't want to talk too much about the RFPs here, just because there are all sorts of rules the county has about discussing RFPs outside of the RFPs and sort of the public process. I can tell you sort of broadly, we're expecting the RFPs to come out pretty soon, because we want, I'm sure most or all of you know, the county contracting process is not rapid. And so we want to be able to get these projects going in January, ideally. So my hope is that the RFPs are going to come out next week. There'll be 2 separate RFPs, so one for the outreach component and one for the rapid rehousing component. And yeah, I can talk sort of briefly about what the COC discussed, because that's already public, but I know not everybody here was at that meeting. So for the outreach component, the goal is to create a really robust outreach program, and something that especially will cover the parts of the county that are not San Rafael and Novato. They can also operate in San Rafael and Novato, but the rest of the county has even more woeful outreach coverage. So we really are looking for something to be sort of broad and focused on the folks who aren't getting outreach to at the moment. Rapid rehousing, just generally, I think, it's a huge amount of rapid rehousing money, and it has to be spent pretty quickly. So I think most people who are eligible, I'm hoping will be able to serve. I know Ritter has experienced in the past, sometimes it's hard to find folks who are eligible by HUD standards, because so many of the folks who rapid rehousing would be appropriate for are, they're working, but they're doubled up. And if you're doubled up, then you're not literally HUD homeless. So working that out, I think, will be a thing. We want to make sure that rapid rehousing programs have enough case management that they can help folks who, like, this isn't just a deposit assistance program. We want to be able to serve folks who maybe right now wouldn't be able to afford an apartment, but with case management and help being connected to employment resources and financial learning assistance, getting their finances in order, would eventually be able to be self-sustaining within that limited 12-month period that this applies to. So all of that was was mentioned at the COC meeting, and will also be in the RFP. So this is not secret information that I'm slipping to anybody. But I think that's pretty much all I can say about the RFPs right now. I do know that the holidays are coming up, so whatever timeline I come up with, the proposals won't be due the day of any major winter holidays. I don't want to review them then either, so I will be aware of that people are taking time off for the holidays. So I'll try and make it a reasonable timeline.
Thanks for that information, Carrie. I'm also wondering, in the outreach, as Julie was just sharing, the activities are pretty broad, or those just in relation to this funding, is any activities as captured through this funding source are qualifying activities for outreach, or are we, sorry if I'm asking more than I'm able to, but just wondering if we're, as a community, kind of limiting the type of outreach we're doing, or is it just anything qualifying under ESG?
I don't think there were any, I don't think the COC put any limiting conditions on it. I don't think they had a really specific outreach model in mind. I do think that the goal is for, the outreach should be housing focused as well as being COVID focused. The goal is to connect to folks who, with all the services that are closed right now, people who aren't really connecting to the system of care anymore, being able to draw them back into the system of care and make those connections. So seeing how people are doing, if I know we've had reports that a lot of folks are having increased behavioral health issues because they're cut off from their usual support networks. Being able to make those referrals to help people get support or treatment, I think would be part of that. But yeah, beyond that, I don't think we don't have a very specific, like, these are the exact activities that should be carried out under outreach.
Are there any other questions? Anything anyone else wants to ask? Or if you think of any questions that you haven't thought of right now, we do have you can email us at our Marin email address, and that'll reach me and Jean. So it's marin@homebaseccc.org. We'd be happy to answer any questions or pass along any resources if you're interested in the memo on the waivers or any other information. I'd be happy to share that. Just send us an email.
I have one more question.
Sure.
Is it too early to ask, or is there going to be, I know there's 2 pots of funding, and then one of them is quite large, but I just wondered if there's will it be divided up, will be spliced up somehow into grants that would be between this and this amount, or is it just going to be wide open?
It's going to be wide open. Definitely people can apply for just a portion of it. I think one agency would have a lot of trouble managing to distribute all of that in the time period. I think we'd also definitely welcome collaborative applications, especially one of HCD's priorities that Julie mentioned was equity, and they would like to see some of this funding going to agencies that are centered in and run by people in underserved communities, particularly communities of color and immigrant communities. And so if there are, I think especially agencies in those communities that are smaller, that don't necessarily have the experience with this level of documentation, the way I think most of the folks on this call do, seeing a partnership with a larger agency, I think would be, I'm not going to say would be good in terms of score, because I can't say that, and I don't know if I don't know if that's the case, but that would certainly be in line with HCD's priorities. So I think it would be a good thing to do regardless of whether it would be a good thing in terms of scoring.
Thank you.
Okay, well, it was really good to see you all. I'm so glad you were able to join us. Again, you've got our email if you have any, think of any other questions. And in the meantime, just say thank you for all the good work you all are doing, and good luck.
Thank you, Julie.
Thank you
Jean.
so much for all the information.
Thank you.
Thank you.
Thank you.
Thanks, everybody.
Take care.